All right, I'm seeing mostly unfamiliar faces. By showing hands, who has taken one of my courses before? You. Not gonna lie to you guys, I haven't had a chance to look over the individuals just because I have so much. But I'm at the point now where it's like, there's no way I'm going to build any sort of meaningful personal relationship with each and every one of you guys. But it is what it is here at UCF. So, good. By show of hands, how many of you guys are juniors and you're seniors? Nice. Okay. I remember you, man. The last one. Yeah, yeah. That's right. That's right. I didn't recognize you walking in. That's crazy. Yeah. Cool. Individuals on Zoom, can you hear me? I just need one of you guys to give me a thumbs up. Anybody? Okay, cool.
Should I pull up Zoom?
Nah. That will not be necessary, sir. Promise you guys, I'll explain the course. I'll explain my situation. I'm also recording. So, I need somebody to remind me if I'm about to go off the wall. Remind me to like stop the recording. I can talk my shit and then come back and then. But considering that you guys are upperclassmen at this point, purpose of the class really is to not waste your time. I don't like, well, okay, let me stop recording. You remind me to press record
Okay,
after I'm done.
all right.
I'll resume until we're good.
Okay.
Appreciate it. The first 25 minutes or so, I'm going to introduce the course. I'm gonna give you all a understanding of how this will be organized. And then from 11 to 11:10, 11:15, I have my PhD colleagues come in to recruit. By showing hands, how many of you guys have been to a kinesiology related class that has had some sort of recruiting pitch done? Raise them high, okay, cool. So let me tell you what this is. I am a PhD candidate, and the rules of a PhD student is you don't leave until you finish research. So that simply means if we have no study participants, we're gonna stay here longer. So we really depend on you guys to help us out. Not only engage in some interesting research in the kinesiology field, but also helping the graduate students here graduate. So all I'm asking is to please pay attention when they're, when they're presenting. And who knows, if you find something interesting and worth pursuing, you guys may be in my position. And please disregard my disposition. I'm actually very excited for this class and this semester. A little about myself. I didn't have to cut, man, but it went this way. Yes, my name is Jonathan Bossejou. I go by JB. I am a PhD candidate here in the School of Kinesiology and Rehabilitation Sciences. So no classes for me, which is nice. Fully devoted to my dissertation research. Throughout the class, maybe this class and next class, I'll explain a little bit about that. But the name of the game here is to not waste your time, get you in, get you out. And for those students that are interested in engaging in more scholarly activities related to the material, there will be opportunities for that. But it is not mandated by any means, shape or form, all right? As I mentioned, the priority here is get the information. And most importantly, prioritize those opportunities that will help you in your future. Okay, so this is a mixed mode course. How I have things structured so far is I'll lecture in person this week and next week, and then we have our exam. A lot of this information is review. By a show of hands, how many of you guys have taken anatomy and physiology? Right, so this is a review. Kinetic anatomy is essentially a deeper dive into the musculoskeletal system. All right. So mixed mode, after this week and next week. A lot of the lectures is already pre-recorded. I'll have hopefully open class dates that if you guys want to come in, we'll do more interactive activities. And I can address more specific inquiries related to what you do for work. All right, so by showing hands, how many of you guys are like working in the field, like as a personal trainer or PT tech, right? Cool. So again, my suggestion is to obviously prioritize that. You'll get the content, these are videos, so you guys will have these videos forever. Or just disregard it after you watch it on 2-speed, I really don't care. Either way, I think the information is good regardless. And for those individuals who are looking to pursue any graduate education, it's a nice foundation to your graduate level kinetic anatomy and physiology related coursework, all right? By a show of hands, I love that first. How many of you guys are interested in grad school? Yeah. What about future PTs? Okay, not too much. OTs? MDs? We need more. We need more MDs and DO. DO, what about DO? Chiropractic. Yeah. All right, so as I mentioned, make sure to prioritize those outside activities and the content will be available for you. All right, here are some course objectives just mandated by the program. This class and the other class that I teach, which is applied biomechanics, I teach it primarily related to individuals interested in obtaining their personal training certification and their CSCS exam. All right, so there's not a lot of exercise phys really related to this. And a lot of the practical application that I reinforce the concepts with is primarily through resistance training. And that's pretty much sort of my practical background before I decided to pursue a PhD. All right, how many of you guys read the syllabus and completed the introductory materials? All right, so please make sure you do that before the end of the day, so you guys don't delay your financial aid disbursement. This book is not required for this course. All right, it is available. I also enrolled this course in the first aid program. So you can access the online text for a reduced price and everything you need to be on there. But as I mentioned, if you want the A in this class, I don't make it hard. It's very simple. Just follow instructions, do the work, and you'll get the A. The A shouldn't matter that, it's a mere formality at this point. It's really what you do with the information, right? So I'll say all this to say I don't make my classes hard at all. My personal philosophy of school is to reinforce what you're already doing. Especially now, the landscape of higher education is changing drastically. Information is readily available, right? So, as long as I can reinforce how you can access that information that you need in a practical setting, then I've done my job. All right. Okay, so not necessary birthday stuff. All right, so we'll have after every class, just a simple online quiz. You guys will have 2 attempts to complete this. These quizzes, outside of these next couple weeks will be pretty comprehensive. And it's all just anatomy related stuff. So it'll be bony features, muscle features, and then a lecture quiz. All right, so each of these quizzes, you'll have 2 attempts to complete. And they're all open book and open note. Another thing, all of our exams as well is open book and open note. You're welcome. All right, so like I said, the goal of this class is to not have you stress about doing school, right? The goal is for you guys to be more aware of the anatomical structures and concepts related to human movement and applying that to what you guys do, all right? Also, I am a huge basketball fan from New York. I'm a diehard Knicks fan. So any blasphemous comments related to the New York Knickerbockers? Are you a Knicks fan too?
Me?
Nah, not you. You behind me. Hey, it's about time to come out the shadows, man. Yeah, we don't tolerate fair weather fans, right? It's that window, man. By show of hands, who follows basketball? The NBA. All right, for those that don't, it's gonna be a long semester if you guys are here, because it's gonna be a whole lot of basketball references. Yeah, I got some individuals in the chat. Go Knicks, Jalen Brunson is my hero. He's my hero too, dog. Not gonna be a lot. Okay. Also, like, I like to get on tangents. I've been doing this for a while, so I just want to keep things like concise. So, this gig is like half instructor, half like passive entertainer. But at this point, man, we're all busy, you know what I mean? Chop it up a little bit, but as long as I have your attention, that's the most important thing. Like I mentioned, I've been doing this for a couple of years and the attention span has just dwindled drastically. So I'll make sure to give a lot of breaks after like 15-20 minutes, like a 2 to 3 minute break. I want you guys to like actually take the break, stretch, stand up from the chair at least, you know, and then we'll go back at it. All right, so we have a total of 4 exams. So we have like the introductory section, so we just go over structures and movements. Again, I'll really breeze through this. This should be a review. And this is meant to set the table for the online lectures. Because you'll notice on the lectures, I'll use a lot of the terminology that I'll briefly go over for the next 2 weeks. So in order to organize yourself and not have you confused when you're watching those lecture recordings, please be sure to pay attention and be familiar with the concepts that are outlined in these first couple weeks. 15 minutes. All right, all the assignments will be completed and submitted online through web courses. Mentioned everything was open book, open note. Okay, also the assessments are time. For the quizzes, I'll probably just negate that timing or just extend it drastically. But for the assessments, because they're open book and open note, you will have a minute per question time limit. For those individuals who completed the student accessibility services application, I've gotten those emails, but I've been bombarded with emails the last couple weeks. For those students, please send me a web course message So that way I can write your name down, and before each of the assessments, I can adjust the time limits accordingly. All right. Okay, also, I have Zoom going, so for all of the in-person 5 sessions, they will be posted. As I mentioned, a lot of the lecture content is already recorded. However, even for the in-person dates, I want to give you guys flexibility. I encourage you guys to come into class for the first 2 weeks, just to kind of build that foundation. And then after that, it's really up to you. I'll pull up the course schedule here in a moment, and then I'll discuss where I'll hopefully offer more interactive activities, and we can play around with some novel technology that is used in the industry field and that relates to the content. All right, so pretty straightforward. Okay, so 3 exams, excuse me. Should be, okay. Yeah, here example. Same thing, each exam is worth 20% of your total grade. All the quizzes from a cumulative perspective is also worth 20%, but then your final project is worth 20%. A brief synopsis on the final project, you'll essentially create a kinetic anatomy profile of particular resistance training exercises. And my suggestion here is to don't reinvent the wheel. Do what you do best. The goal is to make sure that you're able to apply these concepts to what you do on a consistent basis, all right? So very simple and straightforward. All of the due dates are outlined in the schedule. Again, I'll pull it up here in a moment. They are subject to change, so make sure you kind of check that periodically. But typically though, all of the assignments are due the Thursday to Friday at midnight, so it'll be Thursday, 11:59 before that following Friday. That's sort of like a rule of thumb, sort of thing, all right? But that includes all the quizzes. How many of you guys looked through the course schedule? All right. So all of the highlighted dates are the dates that I plan to meet in person. Again, those will change once I know my schedule, and I'll offer like open lab dates for individuals who want to come in and engage in an interactive activity, or you just want to stop by, ask a question, and dip out. All right. Any questions so far? Cool. As far as reaching out to me, I don't have any set office hours. So I'll just do everything by appointment. 9 times out of 10, it'll probably be some sort of like Zoom meeting situation. I prefer you guys to contact me via the web course messaging app. So you guys should be familiar with that by now. I like to save my school email for more work-related type stuff. And I do check those periodically. Just give me around 24 to 48 hours. Haven't been great with this the last couple semesters, so I'll be sure to try to get better. But if I don't answer the first time, please feel free to message me again. Like it's no big deal. All right. If it's real urgent, I'll get back to you. All right, so late work, again, all of the due dates are explicitly stated, so I do not accept any late work. This does have a caveat though, if there's any sort of circumstance that is preventing you from turning in assignments on time, just let me know ahead of time and we'll square that away. The late work policy only applies to those situations where I have no prior notification. And I already programmed that through Canvas, so it's automatic. And again, if there's no communication on your end, the late work policy will apply. All right, so anything turned in after the due date will be an automatic 20% grade reduction. And then 10% off each day following. All right, almost get on time. Here's the breakdown. All right, so here is our grade and notions. I do round up. So please be sure that you pay attention to this. There is no exception, so if it's a 89.4, 89.4 it is, all right? No debate on these. All right, I think that's it. We have 5 or so minutes before my colleagues come in and recruit. So what do you guys want to talk about?
Our stuff was it in Michigan before we.
Oh.
Right to it, right down the business.
Let me pause my recording here.
So my final research project is looking at the impact that the menstrual cycle has on recovery from exercise. And we're looking at this from a bunch of different angles. So we're looking at it in terms of actual, how do cells recover? Like I'm gonna look under a microscope, we're gonna see, are they changing? Does that impact muscle regeneration? Does that impact strength? That type of a thing. We're also going to be looking to see how does mood impact recovery and enjoyment with exercise across the cycle. All of these things may seem pretty straightforward, but they've never actually been looked at before. So this is the very first time an actual clinical research trial will look at these things for women. So this is the very first time. So all that Instagram girly hype you see on the internet about cycle syncing and matching exercise across the cycle, there's no research to back that up. We're attempting to do the very first study that does that. So this particular study, we are looking for women who are not currently on a hormonal birth control because we do need a natural menstrual cycle. If you're not sure if you qualify in that area, I'm more than happy to have a private conversation with you, talk about it, or if you're like, I really want to be a part of something like this, we have some other sort of side projects that you might be a good fit for as well. Additionally, you got to weigh at least 110 pounds and have a history of resistance training. Resistance training just means you go to the gym or Pilates or yoga or a combination of those things about 3 times a week, and you're comfortable doing activities like a squat. Other than that, the visits are going to vary in length from like an hour all the way up to there's a few times where there are a longer 7-hour day. However, you're not actively doing things for 7 hours. You're mostly watching like Netflix for a few hours. We provide a lunch for you, or I can take you to a class and pick you up from class like a good little kinesiology science mom. So we have the ability to be flexible with schedules. Weekends are on the table, all of those fun things. But there are 12 visits across about 3 to 4 months, depending on cycle length and how fast you're willing to pop into the lab and get screened, that type of a thing. So it is probably going to be one of the longer studies for the semester, but it's also going to be the only one that's ever been done in this area. Does anybody have any questions for me? No?
Why 110 pounds?
Because we draw blood a certain amount of times in a week, you have to be a certain weight just for basic safety stuff. It's like a standard practice for this type of project. But yeah, unfortunately, we can't take anyone under 110 pounds for this one. If you're close though, you want to put on like a big meal and come in for a screening, I got you. Any other questions?
Even if not for yourself, if you have any friends that also qualify, please encourage them. Please, please, please.
Yes. So if you're interested in setting up an appointment with me just to talk, scanning the link does not mean you sign up and you're like signing up for 12 visits. It just means you're willing to have a conversation, go through a little bit more screening information. And if you decide you're like, actually, this is really cool, I really want to do it, we can move forward with the process there. Additionally, I'll go the old fashioned way too. I like to have a mix of them. I'll leave a lovely little sign up sheet to pass around. Please just make sure that it gets through everybody. And if you're interested, just write your name and your email down. Try to make sure that it's an email that I can read. If not, I'll search up your UCF email and probably just send it there. But I look forward to hopefully seeing some of you guys pop around the lab. And if not, best of luck in your semester, and everybody else, keep going. All right, thank you.
Sure, sure.
Start with you, Liz.
Yes, the emphasis on the female athlete is growing exponentially. All right, we saw the shoe contract that Caitlin Clark signed, right? It's coming. It's coming. So this research will definitely contribute to those growing areas. All right, next we have Mr. Mason Howard. He will describe his study.
Oh, you're good, you don't have to.
Is it this?
That one's shot.
Okay.
I can-
Yeah, I got the other
Whatever's
one. I got the
easier.
other one.
Yeah,
I got the other one.
whatever you. Hi, everybody, my name is Mason Howard, I'm a first year PhD student, I work in the blood flow restriction lab, so. How many people in here, you ever heard of blood flow restriction training? Yeah, I'm sure you've seen on, Instagram, someone take a rubber band, they tighten it up, they're getting gains, all that fun stuff, right? Okay, well, a little bit different in our lab. We're very specific and we use pneumatic cups, just like a blood pressure cup, okay? When we select our pressures. But what's really interesting about blood flow restriction, especially when you lift light weights, is we can see similar muscular adaptations with increases in muscle hypertrophy and to some extent strength too. Just the same as lifting a heavier weight, right? So if someone can't lift a heavy weight, maybe they use blood flow restriction lightweight, and they can see those same adaptations, right? That concept's pretty neat. But what my study's looking at is 3 commonly used low load blood flow restriction exercise protocols to see, can we compare them? What are the neuromuscular responses that we see for all 3? Specifically, we're gonna have 3 sets to failure, 1 set to failure, and a 75 repetition protocol. Okay, and it's gonna be with just a leg extension, right? There's my demo if you don't know what the leg extension is, but I'm gonna assume you guys all do. With the blood flow restriction cuff on, all right? So pretty cool, pretty neat. How many of you guys wanna do PT? Physical therapist? All right, what's really neat is a lot of physical therapists actually utilize blood flow restriction in their protocols to help patients and clients improve, right? It's a great tool and intervention that we can apply. So if you're interested in this and maybe want to be a part, you might learn how this blood flow restriction is utilized, as well as some of the protocols that maybe you end up using in your career later down the road. Okay, a few things to note though: you need to be between 18 to 35 years old, and you need to be physically active by ACSM's guidelines. Okay, that's equal to or greater than 150 minutes of physical activity a week. That can be aerobic exercise, that can be resistance strength. It does not matter. All right. Any questions about that? Anything along those lines? No? Alrighty. So if you are interested, you can use the QR code on this sheet, or you can just write your first and last name and email address, preferably your UCF, just because if I can't read your handwriting and it's a personal, you might not hear from me. Okay. But I'll go ahead, I'll pass that sheet around and just sign it if you would like to participate. Okay. Thanks, guys.
All right, staying on the BFR tip, we have Mr. Sean.
All right, guys, I know some of you, Sean, Blood Flow Restriction Lab, we're Epic Lab, but now we're transitioning to BFR Lab. Not gonna give my whole spiel of BFR as Mason just described it, but essentially what this is ischemic reconditioning. So think of BFR, but we're not gonna apply the cuff while exercising, we're gonna apply it before you exercise. So when you exercise with BFR on, like Mason said, you would lift those areas by weight. Right? But what this is trying to do is give you that same effects of restricting blood flow and then going to exercise. So the problem with ischemic reconditioning is that they use really high pressure. And what we're trying to do with this is look at low, moderate, and high pressures to see if there's a pressure specific effect on exercise performance. So that's the muscle function side of it. So we'll have you do like strength testing, and then you'll do a set to failure, and then we'll have you do strength testing again so we can compare pre and post. And then we'll also look at your microvascular function while we're doing these cyclical ischemic reconditioning bouts, because there's a lack of information there too. So we'll look at like muscle oxygenation. We have a cool sensor now too, it looks at skin blood flow. But yeah, and then same eligibility as Mason, 18 to 35, recreationally active, so you don't necessarily have to be like a bodybuilder or powerlifter, but you don't have to be like a,
Not like JB.
you know, physically active, right?
Said not like JB.
Do normal, Come to all 5 visits. First visit is a consent, high grade blood pressure.
What's that make me then?
Second visit.
Then what's that
is
make
same
me
thing,
then?
we're just convenient for reliability on our end. And then visits 3 through 5, those are the ischemic preconditioning events. They're just randomized. You might get high first and moderate or whatever the case may be. And then, you're offering extra credit, correct?
Yeah.
So by participating, you get extra credit, right? If you have any questions, let me know. Similar to Mason, I have a sign up sheet, has a QR code on there too. But any questions? Good. It's 5 visits. How many of these? 5 visits, so if we work around your schedule. So the only rule is, yeah, so you can come in and we do it 1 week, we can try and knock it out all in 1 week. We'll say, we can't do it all in 1 week just because when it comes to visits 3, 4, and 5, we have to separate them by 72 hours. Because we're randomizing the pressures, but we don't want the effect of one pressure bleeding into another. Does that make sense? So probably in like 2 weeks is the quickest we can do it if you want to go like back to back. Right? But yeah, we work around your schedule. Any other questions? Cool. All right, I'll pass that around, but thanks, man. Really appreciate
Thanks,
it.
oh, for
Yep.
sure, for sure.
Yeah.
As I mentioned, guys, we really depend on you guys to help us out on the PhD side of things. But it's BFR training, this is becoming widely adopted in rehab and performance settings, all right? So if you guys didn't catch the drift yet, our research agenda here at UCF is definitely approaching more of the innovation R1 level type of research. R1 means that we're pretty much on par with those heavy hitter universities. You have a question?
Well, I just saw that you only get extra credit if you go in for 2 hours or more, and I signed up for one that's 2 hours, because like one at 5. But I know there's other extra credit options I saw too, so
So,
I'm doing the lower back pain segment.
okay. And then you said it's
2 hours.
just 2 hours? So you would qualify for the extra credit?
Oh, because I sure it was 3 hours.
Oh, okay, well,
Because that's the only one that I can do, but.
let's talk about that, all right? Yeah, as far as the extra credit, and I can actually pull this up here right now. So I'll finish the course. I'll talk a little bit more about the next, but I'll just first like go over it.
With, I think his name was Mason, right? You have his like email or anything to reach out to him?
Yeah, so his, to be honest, if you even look his name up and type in UCF, Mason Howard, his contact information will be there. If not, his email should be either on that sheet or actually here as well. You could take a picture and write it down. Yeah, his contact information, right?
And also, does he work with people health?
Yes, yeah, yeah. Yeah, so those are Dr. Hill's PhD. So they're Mason's year 1, Sean is year 2, so they're really active on the data collection side. So it's a nice time to get involved if you are interested in that sort of research, because that's all he does. All right, they've been doing BFR work in a lot of different populations. They did publish an article exploring the effects of BFR training in individuals with MS. So this is increasingly becoming adopted across the rehab space and beyond. All right, so a lot of his helpers, even a lot of helpers in our lab and future MDs. So we're really tapping into the UCF medical school pool a little bit. And the goal here is to reinforce these kinesiology concepts in that space. All right. Any questions, comments, concerns related to that? Also, you guys are more than welcome to participate in more than one, right? So don't feel like you only have to choose one, right? If you qualify for another and it's all fair game, you're good. All right, let's take a 5-minute break. We'll come back here at 11:15. Somebody remind me, I'll pull up the extra credit stuff just to briefly go over that. Long story short, I really want you guys to participate in research. There's other opportunities as well, which includes going to a conference. The Institute here at the School of Kinesiology is holding a seminar series. So throughout the semester, there are 4 like lecture type of field with experts in the field. And it covers a broad range of things and perspectives. So if you attend at least 3 of those and write like a summary on each of those 3, I'll qualify as extra credit as well. And extra credit corresponds to 2 course points. And that includes like, if you fully meet the requirements for the extra credit, that means you'll have 2 points added to your grade. So just because you do it, doesn't mean you get full points. And that last phrase mostly implicates the other option. Like, I think there's like a poster option that I offer to you guys as well for more artistic individuals. And I don't want it to be one of those situations where you just like slap something together and you get 2 points. Right, and I'll provide examples from previous semesters. I have a question here. How heavily do you recommend the textbook for this course? I think it's a good book personally. Like, if you can afford it, go ahead and get it. I think it's like a nice introductory level class, and I think it streamlines nicely for those individuals wanting to go into PT, OT, MD type stuff, if you're looking again the ortho specialties. But for this class, you don't need it to be successful. All right, a 5-minute break. Let's come back here at around 11:16, 11:17. Going to pause the record. I'm trying to start here shortly, as I mentioned. A lot of this stuff is review. On Canvas, you guys should have access to your student template notes. So these notes are pretty much the same version as my slide deck. And these are the notes I would like for you guys to use for your exam. And this is just a way for you guys to kind of stay with me while I lecture.
All right, I'll do every, like, different lectures, that's all needs to be.
Yeah. So yeah, by showing hands, how many of you guys are able to access your student template notes? So it's fill in the blank. As I mentioned, this will be recorded. So if you miss a blank, don't worry about it. You're more than welcome to rewatch the recording. But again, these are the notes I would like for you guys to use for your quizzes and exams. All right, so I'll make you work for it a little bit. And once you have it, then you're solid. And you said we can't see it. You guys are able to see it though, right?
Lecture 1.
Lecture 1, yeah, just lecture 1, yeah, so next week it'll be lecture 2, and that will comprise of our first block, if you will. So just an overall review, just to get us ready for the content. No, this is on Canvas. All right, recordings on. All right, you guys, this will be relatively quick. Again, a lot of this information should be hip pocket stuff, things that you already seen or heard of before. If I'm going too fast, please let me know. And if you want any in-depth conversation on the materials, please let me know that as well. All right, moving on with the structures. These are merely just the foundation of our functional anatomy. There's various types of tissues we'll be working on in this class. By and large, we'll be focused on muscle tissue, nerve tissue, and the connective tissue. The connective tissue is made of a variety of different tissues. This includes bone, cartilage, skin, fascia, tendons, ligaments, etc. And these are just the entities that connect one structure to another. As far as the muscle tissue is concerned, even though we have our skeletal, cardiac, and smooth muscle, for this class, we'll primarily focus on muscle tissue, right? And more so related to that, how we are able to contract our muscle for human movement. So we'll be primarily focused on the somatic nervous system, right, and the efferent and afferent pathways there. Again, on the nerve tissues, those efferent and afferent pathways correspond to our peripheral nervous system. Right, so these are the nerves that come out of the spinal cord. Then we have our central nervous system, which is our brain and our spinal cord. We also have our epithelial tissues, but we won't really get into that much this semester. A synopsis of our bones, we have, we'll say over 206 bones, and the purpose is to support locomotion and protect our important internal organs and structures, also important for blood cell formation and mineral storage. Most importantly, calcium, which is the foundation of skeletal muscle activity whenever the actual potential propagation starts. We have various types of these bones. However, for the purpose of this class, I want to reinforce the concept of Wolff's Law. Wolff's Law typically means the bone's ability to proportionally, essentially, yeah, but how is it getting stronger? What do we have to do to that bone?
I guess, when you impact.
You have to load it, exactly. So our brain, my fault, man, I'm still in dissertation mode. Our body is very adaptable. So whenever you do an activity over and over and over again, your body has an ability to adapt to that specific movement or task. And this happens in a variety of forms, not even from a neuromuscular perspective, but also from a structural perspective, right? I like to give this example, which subject A, let's say he squats 400 pounds, 3 to 4 times a week. Don't do that, by the way, but it's an example. Compared to an individual who squats 100 pounds, right? Comparing to those two individuals, which one would you expect to have a larger bone density? And let's say we're talking about the femur and the tibia. Which one? Why? More load consistently, right? You guys know the cells that correspond to the laying down and the collection of bone cells, osteoblasts and osteoclasts, right? So it's nice because not only do the bones respond to load, but they also respond to how the load is applied, right? So the brain, shoot. I'm gonna say brain a lot, guys, because that's part of my dissertation that I've been presenting that like crazy. All right. So again, we have these different types of bones. By and large, we'll be focused on long bones, because these are the bones that are able to withstand not only force, but from a structural perspective, human locomotion as well. Just to give a rundown of the characteristics of long bones, we have our diaphysis is made up primarily of this compact bone, right? The outer layer here is the periosteum. All right, and then once we go on to the distal aspects, we have our metaphysis and our epiphysis. Our metaphysis is where our growth plate is, also known as our epiphyseal line. And the metaphysis all the way to the distal ends are typically made of this spongy bone material. All right, so very, very bare bones type stuff. I also added some extra contextual information if you guys are interested, but I will not reinforce that in this class. We also have a variety of different bones. We have short bones, flat bones, irregular bones. They're named how they're named based off their structural characteristics. The short bones are typically the bones you see in your wrist and the mid to 4 foot areas of your foot. We also have our flat bones. Main reason here is to protect internal structures. This includes our skull, ribs, and sternum. We have our irregular bones. These bones are more so specialized. All right, so some bones that fit into this category includes our vertebrae, our pelvic bones, and our hyoid bones. And lastly, and most importantly, my opinion related to locomotion is our sesamoid bone. All right, these bones are also small bones embedded in the tendon, which increases our mechanical advantage. So when I say mechanical advantage, does anybody know what I mean by that?
I've heard it before, but I can't put my finger on where I heard it from.
Even if you're wrong, I like engagement, all right? It makes the class go by a lot more smoothly and effectively. And this concept of mechanical advantage speaks to more so of our biomechanics components.
Wait.
It's kind of like whenever you have like a lever.
Yes.
you can put the fulcrum closer to
Yes.
the weight, that way you have.
Yes, exactly. So by showing hand, you're exactly right. So by showing hands, how many of you guys are familiar with lever system? Right, first class, second class, and third class. All right, so we'll touch on that more so at the end of the lecture. But this mechanical advantage is referring to our ability to produce force. So from a muscle perspective, and let's consider the active properties, how do we produce force? Think about muscle, it starts with a T. Okay, so we're getting there with the mechanical advantage, we're getting there, tension, right? The tension by the myofilaments of that particular muscle, so actin, myosin, all that stuff. Right, and we'll get there. So in terms of the mechanical advantage, we have to consider the origin and insertion points of a particular muscle and the fulcrum or the axis in which that muscle is acting upon to move a particular limb. All right, so if we talk about a lever system, hypothetically, if you move the application of force closer to the axis point, I'm gonna ask you this, and I don't expect you guys to know this, but let's play a game. If I move the point in which you apply force closer to the axis, is it easier or harder to rotate that object? By easier, raise your hand. By harder, raise your hand. So the moment arm, you guys are familiar with levers, is the distance between the application of force and the fulcrum. So when you have more leverage, is that moment arm bigger or smaller? If you have more leverage, think about it. It's gonna be bigger. More leverage, right? If you guys look all the way back there, how come that door handle is all the way out compared to the axle rotation?
Because
Because
it's
it's
easier
heavy
to
on the
push it
inside,
open
you can't
when it's further.
It's easier to push it open when it's further because you have more leverage. Does that make sense? So from our force producing capabilities, if we're able to extend that insertion point, we're able to use our force producing capabilities more advantageously. All right, so this is only related to our force. Does that make sense?
So the longer, the stronger.
The longer, the easier.
Oh, okay.
That makes sense. So the longer, the easier, and that means that we don't have to produce a lot of tension to rotate that object. Does that make sense? Like hypothetically, if that door handle was closer, you'll have to produce more force to rotate. So it's easier. So by mechanical advantage, we're able to efficiently produce force in order to rotate our limb. Does that make sense? Does it make sense? We're good?
Yeah.
All right. So in terms of our sesamoid bones, they're placed in positions that extends that moment arm, right? A prime example is how the vasti group causes us to extend our knee. right? So from an anatomical perspective, the vastus lateralis, medialis, and the rectus femoris, they attach to the patella tendon via the quadriceps. They attach to the patella bone via the quadriceps tendon. All right, so tendon connects muscle to bone. Right? But the patella here acts as a sesamoid. So what that means is there's another extension point from the patella to the tibial tuberosity. Because of that, this right here essentially extends the capability of our quadriceps to extend our knee. Does that make sense? We also have sesamoid bones along our big foot as well, our big foot, big toe. All right, so from a biomechanics perspective, the big toe, the functional anatomy of that big toe can tell us a lot.
This bothered me so bad. I think I remember either from anatomy, she was explaining how we can't lift our own body weight or something like that. Oh my God, I wish I could remember exactly what she said. In the sense of, I think she was talking about that.
Okay, we can talk. We can talk. All right, so here are some bony anatomical landmarks. I just want you guys to get familiar with these concepts. I'll touch over it briefly, but I actually have the definitions on the later slides, all right? For the purpose of the lecture, I just want you to organize the nomenclature related to these two main bullet points, right? So in terms of attachment sites for our muscles, they would typically attach either on a tuberosity, a process, a tubercle, or the epicondyle. All of these are essentially individual protrusions of a larger bone that muscles attach upon. All right, in terms of joint articulations, this typically happens via the site of the condyles, or if there's really no bone-to-bone articulation, a muscle will typically sit on some sort of region. An example of this will be a fossa. Right, so prime example, in your scapular region, your subscapularis muscle will essentially sit on this fossa, all right? We also have the spine, which is a long, thin protrusion. We have our facets, which is primarily focused on the spine, and this helps us to engage in our rotation and flexion action of the spine, particularly the individual movements from each vertebrae. We have a foramen, which is a small opening and a sinus. So again, just be familiar with this and mainly understand that our major attachment sites are in particular areas of larger bones, which have special names. All right. As we go on throughout the semester, I'll typically use that nomenclature for each body region. All right, so a little bit about joints. These are where two or more bones articulate, also known as an articulation. All right, by a show of hands, how many of you guys are familiar with joint actions? Joint actions, raise them high. Are you guys also familiar with planes of motion? All right, okay, so we'll see. Because next week I have a couple activities and I like to offer extra credit points and it gets pretty competitive. And I like that shit. Right? So let's test your knowledge. What are the main joint actions on the sagittal plane? Flexion extension. He's like, oh, I didn't know that. No, just only a joke. So yeah, so you guys are familiar with these typical joint actions, you know, flexion, extension, abduction, adduction, internal rotation, external rotation. These are typically, those are nomenclature that we characterize joint actions or joint activities. However, in order for those activities to take place, the actual articulations between the bones have to engage in particular movements, all right? So this is where these arthrokinetic movements, is how I like to call it, come into play. And this includes rolling, gliding, and spinning. And this is very important. And I'll give you an example of that. Simply because a joint can engage in the same joint action, but these movements are done differently. Are you guys familiar with open and closed chain movements? Okay, so let's take the knee extension action, for example, right? If I'm in this squatted position, if I come up, my knee is extending, right? But because my distal segment, which in this case would be my tibia, is contacted to the floor, that's a closed chain movement. Compare that to this. When I kick out, my knee is also extending, right? But because my distal segment is not fixed to a harder surface that is immovable, that would be open chain, all right? So again, from here up, extension is the same thing, but because different bones are moving in different activities, each of those bones expresses different arthrokinetic characteristics. Does that make sense? So here I give a prime example. So in this situation, this is closed chain. The tibia is stationary. So all the movement is occurring in the bone that's moving, which is the femur. Does that make sense? And vice versa. So once we get into the knee joint, I'll explain more so there. This is just to reinforce these concepts. Are we clear? Yes.
I was just gonna ask, does that change like? Cause I know like obviously extension, same muscles being worked, but does that do something different to the bones depending on the workout you do?
For sure. For sure. Yeah, so like, I don't know if it's been done, I'm sure it has, but you can go on PubMed and you can, search up the difference in quad strength and size between individuals who just did heavy knee extensions versus individuals that did heavy squats. And find the differences there, right? The name of the game here, especially for loading, at least in my book, is specificity, right? So your body is very smart and is able to adapt to not only the load that you impose, but how you're doing the load, right? So not only from a bone perspective, but also from a muscle perspective. All right, so joints are also supported by ligaments, muscles, and other connective tissue. Again, this is very important because you'll have some joint regions in which the articulation is very weak. And because of that, that particular joint will rely more so on the supporting structures, right? Common example would be the shoulder, right? By showing hands, how many of you guys have taken the undergraduate cadaver dissection? Nobody has? All right. Individuals going to grad school, you guys will complete a full cadaver dissection and you guys will hate that. And you'll get over it, man. Like you'll definitely get over it. But it's really surprising to see how the human body is, like, for real, from a cadaver perspective. This is different from fresh tissue, but either way, I digress. But take this example between your shoulder joint and your hip joint, right? From a structural articulation perspective, which joint is supported more so by their surrounding muscles? Would it be the shoulder or would it be the hip? Support, yeah, so I know what you guys are coming from. The hip is stronger because of the structural articulation. The ball and socket type joint, because it's there, and also you have a lot of muscles going through that region. Your more than likely to pop your shoulder rather than pop your hip, is what I'm saying. So the articulation in regards to the shoulder joint, the humeral head and that small glenoid fossa of the scapula is very, very shallow. So the shoulder primarily relies on those supporting structures for dynamic stability, right? A common theme you'll see in this class by and large, if you have more structural stability, you kind of sacrifice your range of motion and vice versa. Does that make sense? Yeah. A lot of these concepts I'm already explaining, so I can just kind of, run through these next couple slides. Here I have an example of the shoulder, right? If you remove the skin and the fat, you have your shoulder muscles. You remove your external muscles, you have more deeper scapular muscles and muscles that correspond to the extracapsular perspective of that shoulder joint. And then you have more ligaments, and then you eventually get to the glenoid cavity. So I say all this to say that there are multiple levels of reinforcement about this joint in order to stabilize it. Guys, I'm gonna go for 5 more minutes. We'll take another short break. And we'll come back and finish the class, all right? I have you out of here, 12:15, 12:30 by the absolute latest. I will never, ever, ever lecture to what, 1:30? That won't happen. Because what's the point? I have this recorded, but I don't get it. All right, so here are the review of joint classifications. You guys don't have this slide, but I just thought it was appropriate for me to give this to you guys as a way to organize different joint classifications. And joints can be classified from a structural and functional perspective, all right? I want you guys to understand that depending on the source material that you acquire, you guys may see different terminology, right? But these things represent the same thing, all right? So from a structural perspective, you can have bones that connect together from a fibrous tissue perspective. You can have bones that are connected by cartilage. Then you have bones that are freely articulating and movable. And this typically involves your synovial fluid, your joint cavity, and all those perspectives, all right? How I like to organize this information is typically your structural and your cartilage classifications are pretty much the same thing. Within each classifications, you have examples of either immovable or slightly movable functional capabilities. All right, so by and large, if I really had to nitpick, there's really 2 types. One is either slightly movable or immovable, and the other is your freely movable joints. All right, so again, this terminology is from a structural perspective, and this terminology is from a functional perspective. So how it's made up, and from a movement perspective, what you typically see from those examples. All right, I also give this this diagram for you guys to review and organize these examples accordingly. All right, I already touched on a vast majority of these concepts. It's also important to know that the joints that depend more so on those supporting structures are susceptible to more injury if those structures are compromised. All right, it's pretty straightforward information. A common example is, like a pitcher who pitches for 9-10 years. Check the integrity of their shoulder and their elbow. And bet my bottom dollar that there's a lot of joint laxity within those ligaments. And that means that those ligaments have been stretched to the point that they're unable to return back to their original length. Does that make sense to everybody? All right, you guys should really look into like the lives of these athletes who play these extreme sports for a long time, right? Rehab and recovery has gotten a lot better. But if you look at individuals who played in the 70s or 80s, almost all of them has had hip surgery, back surgery, knee surgeries, all that stuff, right? Again, whatever you do consistently, obviously you're paying a price. And recovery is also important, which is a prime emphasis of what we do actually here in the Institute. All right, as I mentioned, for the purpose of this class, we'll be primarily focused on the diarthrodial articulations, are pretty movable. In terms of the diarthrodial joint, these are the main characteristics. All of your diarthrodial joints, they contain a joint cavity, a synovial fluid, and a capsule. All right, so let's consider the knee joint, for example, right? So you remove the skin. What you'll go on, or what you'll hit first from a superficial perspective, is that joint capsule. That joint capsule is typically made up of some fibrous tissue, which include your extracapsular ligaments. So like your MCL and PCL typically come off from this external fibrous layer. All right, and then once you traverse that, you go inside the joint cavity. So once you reach the cavity, this is where you'll reach your synovial fluid. This is the site of joint articulation. Relative to the knee, not only do you have extracapsular ligaments, you also have intracapsular ligaments as well. So these are the ligaments that actually cross inside the joint cavity. From the knee perspective, what are they? You know it. ACL and PCL, right? So just to orient ourselves, extracapsular, MCL, LCL, intracapsular, ACL and PCL. Right, the ACL and PCL are cruciate ligaments because they cross inside the joint. MCL, LCL are collateral ligaments. That just means that they go around the joint. Does that make sense? All right, just to explain that further, you guys are pretty familiar with the different types of joints. I already explained this. I'm not really gonna go in depth with them. I'm ahead of myself. Let's take a 5-minute break, then we'll come back and finish. We're already halfway through. Oh, man. Bro, I used to deal with the really bad herniated disc in high school, and I just didn't really know how to address it. So I just like played through it, played college basketball, and there were days when I felt great, and there were days I just couldn't walk. It was like bad. Now we're straight.
How did you jump on that?
How did I jump?
Yeah, disc, like, that's gotta hurt, like, whatever you're landing.
So,
Where was?
yeah, so like all of these are great points. The it really is, because it matters, like, it matters because like like, it's not black and white stuff that you deal with, you know what I mean? Like everybody has different expressions of these anatomical structures. So for me, I would categorize it as like a bulging disc, but like it wasn't completely out sort of thing, but it was compressing on the sciatic nerve roots. So I was having that neuropathy all the way down my right leg. And that's the worst pain like you'll ever experience. And it's constant. It's like, I don't wish that pain on my worst enemy is that. As far as like, jumping is concerned, I never really felt a lot of the localized pain. It was just that neuropathy and just muscle weakness, So I'm like a right-handed individual, so I'll just like LeBron on these jokers, but she like that one. But yeah, there are moments where I was feeling great. There were moments where I just couldn't walk. So a lot of a lot of physical therapy. I went to a chiropractic school also. So you know, your future PT that has a gripe on chiropractic, man. I get it, but you know, it is what it is. All right. Are you guys familiar with, you guys are familiar with the planes, degrees of freedom, right? So, okay, okay, so a joint that has 1 degree of freedom simply means that it's able to move only in one plane. All right, so let's consider the elbow, for example. The major joint action is flexion extension. That's a uniaxial joint, 1 degree of freedom. All right. A joint that's able to move across 2 planes, so let's say flexion extension, abduction, adduction, and that's it. That would be your biaxial joint. All right, so you're able to move over 2 planes, and then your multi-axial will be 3 or more planes. All right, so depending on the joint type, I gave you guys examples. Make sure you read over it because I'm not going to read it for you. This should be primarily a review for you guys. And again, these joint concepts, of course, will be reinforced as we move on in the lecture. I'll also give you guys some examples here. I really like this graph. It just kind of explains the different joint graphic. And this gives you examples across the whole skeleton, all right? I just explained this. So the joint degrees of freedom just corresponds to its ability to move across multiple planes. All right, so your multi-axial joints will primarily involve your shoulder and your hip. Your uniaxial joints, again, would typically involve your elbow and your knee. The hip is nice because not only can the hip move in 3 different planes, but it's typically strong simply because of the muscle architecture. All right, briefly going over the characteristics of the immovable or the non-movable joints. Sinoarthroidal joints do not have a joint cavity. So if it's not diarthroidal, free movable, they do not have a joint cavity. So there's no synovial fluid, and there's no cavity. All right, by and large, these joints are made or they articulate bones together with the purpose of no movement or little movement. Example of this would be the sutures on your scalp, as well as your syndesmosis joint in the ankle. By showing hands, how many individuals experience a high ankle sprain before? I'm curious if you guys don't mind sharing some of the mechanism of injuries, because for me, I kind of suspected it. I landed on somebody's foot, and how I rolled it was more like anterior posterior than like medial lateral situation. But typically, the typical mechanism of injury there is excessive dorsiflexion action as well. So you said you want to share?
Yeah. I got tackled in a rugby game.
Okay, okay. And traumatic, yeah.
Yeah, right.
Are you playing rugby?
I used to.
Do you know Life University by chance?
Pardon?
Do you know Life University?
Is that, no, probably not.
Okay, okay.
Is it new in the South Florida or no?
No, this is in Georgia. An individual from the Olympics on the women's side was a Life University alumni. And I'm talking about the one that like scored for America to win that bronze.
Wait, that one?
Yeah, she was a Life University alumni.
I grew up in Australia and I knew the lady that missed the tackle on her.
Oh, man. Wow, small world, dog.
Yeah,
Damn.
it's weird.
Damn, yeah.
But I got hip drop tackled on the side. My fibula broke in 3 ways.
Okay,
And then my whole synostosis
yeah,
joint
yes.
flew out. All
Flew out.
ligaments.
Exactly. So a lot of individuals, when you think about like a ankle sprain situation, is usually corresponding to those lateral ligaments, right? In order to reinforce the articulation between the tibia and the fibula, actually throughout the shaft, there's this fibrous connection, if you will. All right, that is very integral in holding those two bones together about their respective shafts. At the distal end, there's like a more reinforced fibrous connection, if you will, and that is typically referred to as a syndesmosis joint. So a high ankle sprain is just a disarticulation of that. Yes.
Compared with people with like who have never gotten a sprain before and people who always get sprains,
Yeah.
is that like a genetic component or is it just like luck?
So in terms of that, and I'm one of those actually, because I play basketball. Typically, whenever you sprain a joint, and mind you, I'm not a PT, I'm not an AT, I'm just here living life, you know? But typically, whenever you sprain a ligament, the integrity of the rehab or the quality of the rehab is very important. Because if you don't take that seriously, the strength of those ligaments will not reach back to pre-injury status. So that means that you're more susceptible for future ankle sprains,
So
essentially.
it's based off
because
of the first injury.
Typically, yeah. I mean, it's like, I'm a realist, like I don't know these individuals, obviously. It can just be like a genetic, you know, we call it an anatomical variation, because everybody has it. Like, I'm explaining general concepts, but how these are expressed is primarily different. So maybe their architecture may predispose them. I know in my Auburn work, my primary professor in biomechanics, as I concentrated there, she was like a huge foot person. So how your foot contacted the ground, she really emphasized the importance of like the kinetic chain from a bottom-up perspective. Right, so that can also be a mechanism. It could just be like faulty foot mechanics as well. I know I'm rambling, but essentially, yeah, if the ligaments are injured and you don't return them back to their pre-injury strength, then they're more susceptible to injury because that joint is not as reinforced as it once was. Any questions related to that? Yes.
Can joints ever really fully recover to the point before injury? Because in another class I heard that once you injure something, there's a higher chance of re-injury. But
Yeah, I personally, I do agree more with that sentiment. It depends, I'd say it depends on the joint. If it's like the knee, I would agree with that statement more, and the reason why is whenever you injure something, it's not only the structural components that you have to think about, it's also like the proprioceptive components as well. So your brain's ability to recognize that body region in space is compromised whenever the capacity of that joint cavity or capsule is compromised. Does that make sense? So it's multifaceted, is what I'm saying. So based off of that, that's why you typically see like a multifaceted approach to rehab now, because it's a lot more than just the structural components that you have to consider. But to answer your question, I can see why they said it, and I don't disagree with that.
okay, so going back to me, if I hurt my knee once, even if I like finally focus on strengthening my knee and do like isolation workouts and stuff, it's still a higher chance I'm gonna re-injure it. It's never gonna be as strong as when I originally started.
I think it depends on the quality of your rehab, to be honest. But yeah, if the rehab isn't great, again, it's like, this is a multifaceted situation. If you don't take it seriously, then of course, if you take it seriously, you know, chances are that you are able to return nicely, but it's always like it depends sort of. If I'm being honest with you.
I was just gonna say, I agree with that, because I've had 2 knee surgeries.
Okay,
Oh,
so
3.
Yeah.
three now, but the first one didn't have as good a rehab, so I re-injured that leg.
Yeah.
But the second one I had on it, it's been crazy, like really good. It's been better than what it was
Right,
before
right.
rehab.
Right, so it's, yeah, it's, yeah, it just depends. I usually default to the rehab. I'm also biased from our research perspective, like my research, really delves into how the brain communicates with muscles and like learns skills, especially from a force reduction capability. So my interest is more so away from the structural components and more so into the neuromuscular realm. I like this conversation. Okay, you guys are.
So how would it change based on, like, you had talked earlier about how some joints are more supported by the actual bone structures.
Yeah.
And some are more supported by muscles. How would that change? Like, likelihood of recovery to full function again? Are you more or less likely if it's like basically a joint fully supported by bone, or more or less likely if it's more supported by muscle?
That's an excellent question. I think, when I hear that perspective, my brain goes into the complexity of the joint. If that makes sense. So that question lies more in the structural integrity, right? So if a joint relies more so on its structural integrity, and let's just say, we're comparing the shoulder to the knee, right? The knee is very complex. It is very important for weight bearing. So you have that, proprioceptiveness and that sensory feedback, which is very important there, as opposed to like the shoulder per se, So even though the shoulder is more supported by those outside components, as long as you address those from a structural perspective, that may increase your chances of full recovery, only because it's not as multifaceted, if that makes sense. So if it's from a structural perspective, as long as you address the structural components, then you're good. But if a joint depends more so on the other components outside of the structural mechanism, then you have to address that as well. Any more questions? That's what's up, man. I'm not gonna lie, this is a pretty dope class. All right, individuals on Zoom, I know you guys are also participating, but you guys aren't here. And I asked you guys to be here. All right, let me speed through this because we're almost done. Touching briefly on the types of muscles, we have skeletal, smooth, and the cardiac. For the purpose of this class, we'll primarily focus on skeletal striated muscles. Again, these are responsible for locomotion, and the functional components outside of the muscle fiber cell or the myofibril is the motor unit. Does anybody know what a motor unit is?
The nerve and all of the.
Yes. It's the motor neuron and all of the muscle fibers that it innervates. So this is my whole PhD has been over motor units essentially, so I will spare you the in-depth the in-depth contextual stuff related to motor units. Long story short, we have different sizes of motor units. Your smaller motor units are more implicated for your precision movements. So think about the eye and the hand. Your larger motor units are more implicated with your larger muscles. So think the vast eye and gluteus and all that stuff. All right. Cool. So muscles are typically named for their function, location, size, shape, structure, and or attachments. All right. We will get really in depth with the nomenclature, but if you guys review the material enough, it'll begin to click. Right, like a prime example is the vast eye group. If you have multiple muscles surrounding a large bone, the name of the muscle will correspond to its relative location, right? The vastus lateralis is the muscle that lies on the lateral aspect of the femur. The rectus femoris, so you know it lies on the femur. And it lies erect or right in front of the femur. Vastus medialis, vastus intermedius. A lot of the nomenclature here, by and large, is named because of a particular characteristic. All right. To reinforce, tendons connect muscle to bone. Ligaments connect bone to bone. All right. The important things about tendons particularly is that it's able to relay passive energy or express passive energy. My biomechanics people, do you guys remember what active and passive components? I know. I don't like doing school. It's a way to ask the question. When I say active and passive properties, what does that mean to you guys? Right, so let's take that into the context of how we're able to produce force, which is from muscles, right? So the muscles' capability to actively produce force is through what, essentially? Cross bridging, creating that tension, contraction, the release of, I want to say ATP, but I don't think that's right, which is why I'm not teaching exercise physiology. But yeah, yes, ATP is necessary because you need energy in order to initiate the action potential cascade, the release of calcium, blah, 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 all that stuff, right? But you need some sort of active component to initiate that. However, muscles and tendons are able to passively store energy. And depending on I say the rate of change, but I just say the change in the integrity of the tissue, you're able to release that energy as well. I want you guys to think of a rubber band, right? From a passive perspective, if I stretch the rubber band, that rubber band has energy. All I have to do is just release it and it would translate. Does that make sense? So muscle tissues and most importantly tendons, they have the ability to stretch. And that stretch stores energy. So I want you guys to think about like your basic plyometric exercise. Are you guys familiar with that? Stretch, shortening cycle, all that stuff, the Achilles tendon, like whatever. Yeah. So if you guys watch, I want to get you guys out of here. You know, typically I pull up the whole YouTube spiel, but I'll spare that. You know, whenever you guys watch like an individual engage in plyometric exercise, or even like a guy just kind of pogo sticking, that doesn't sound right, but you know, pogo hops example, their ability to, you know, jump up and utilize that force doesn't only implicate the muscle's ability to actively produce force, but also the rapid stretch and shortening of the muscles, but most importantly, the Achilles tendon. All right. So that's why I say the rate of the change in the structures as well, because from a practical perspective, that's important. Like if I stretch a rubber band and keep it stretched, its ability to regain its original shape is compromised. The more that entity is compromised, it won't translate as far. So that's why there's a time component in how you release that energy in order for it to translate. I'm basically explaining all these terms here. All right, so these terms include extensibility, elasticity, contractility, and excitability. Extensibility is the ability for the muscle or the implicated tissues to stretch beyond its normal resting length. So here, this is the primary for those structures' ability to store passive energy. So think rubber band. The elasticity is the ability for that structure to return to its original length, right? So in order to maximize the return on our passive energy, those components also have to have nice integrity from an elastic perspective, right? The contractility is the active properties. It's the ability for muscle tissues to actively produce force. And whenever they do that, they typically shorten. And then excitability is the ability for that tissue to respond to any chemical, electrical, or other stimulation. By showing hands, how many of you guys has done like the NMES peripheral muscle stimulation protocol before? Like pain or anything,
Like a TENS unit?
like a TENS unit, yeah, right? So, I mean, what happens when you put those TENS units on the muscle? What happens to the muscle?
Well, depends, if you jack it up, you'll start shortening and.
Yeah, it's jumping, right?
Yeah.
But you're not doing anything, you're just
No.
relaxing, right?
Yeah.
So the term neuromuscular is like broad in my perspective because I'm in it. But excitability really goes into how the muscle is able to respond to an external stimulus. Typically in the form of either chemicals or electricity. All right, some of my, most of my research really included a device called the transcranial magnetic stimulation, also known as TMS. I know you guys have no idea what that means. But typically what I do is I find the motor cortex along the individual's brain and I stimulate a particular region to analyze the involuntary response of a particular muscle. So there, I'm investigating the quality of that corticospinal tract. So how well does the brain relay that external electrical signal from the motor cortex down through the spinal cord to reach the lower motor neurons to engage in that contraction, right? So that's just a piece of muscle activation, right? And I'd say that more so of a top-down approach, right? So everything is multifaceted, you know, you may have an individual that has a great corticospinal tract, but from a peripheral perspective, their muscles are unable to respond to an electrical stimulus, right? Conversely, you could have another individual that is able to respond from a local perspective, but their ability to relay that electrical impulse is compromised. So there's multiple perspectives that you can consider in terms of the excitability. Oh, 1 minute left on Zoom. Okay, I guess my Zoom people are out. Okay, I'm gonna breeze through this because we are almost done. I know I'm saying that, and I promise it's 12:15. All right, here is the basic structure of muscles. You guys should already know what this is. Hypothetically, if we cut this skin open before we reach the muscle belly, we will reach the epimysium. That's just the thin fibrous sheet that covers the muscle. Once you traverse that, you will get into the fascicle, which is covered by the perimysium. By showing hands, how many of you guys are familiar with ultrasound images of muscles, right? Are you guys, for those individuals, those lines that you see, those striated lines that you see, those are your fascicles. All right, so your fascicles essentially wrap around a bundle of muscle fibers. A muscle fiber is essentially your muscle cell. Okay, so going back to the motor unit, a motor unit is a motor neuron and all of the muscle fibers that it integrates. All right, once you traverse that, you get into the myofibril, which contains the functional unit of active muscle contraction, which is the sarcomere. Okay, so that's where you have your Z line, A band, I band, all that stuff, active myosin cross bridging, which all those things that I just named are part of your myofilaments, which are also what actin myosin, troponin, tryptomyosin. Which are proteins, yes. All right. Any questions, comments, concerns related to that? All right. This is a picture of like a fresh tissue dissection situation. That yellow stuff you see there is actually fat. And this is just the epimysium, right? So those really look deep in there, those striations are your fascicles. All right, which is covered by the perimysium. Types of contractions, by showing hands, how many of you are familiar with this? Isometric, isotonic. All right, I will not go over that. This should be bare bones information. By showing hands, how many of you guys are familiar with isokinetic as well? Isokinetic, right? So you're producing force, but you're negating the influence of gravity because it's fixed. So you're producing force at the same speed. So you're controlling for the speed. Because of that, you're really able to isolate the force producing capabilities about a particular joint. All right, it's also important to know that depending on the muscle that you analyze, they may be arranged in a variety of ways. And these correspond to the muscle pronation angle. The main takeaway I want you to write down here is muscles that are arranged more so in a parallel orientation are typically longer and weaker because they have fewer muscle fibers. All right, another common theme here that you'll notice is whatever you lose in terms of force producing capabilities, you typically gain in speed and range of motion. All right, so this goes from a leverage system, and this also goes from a joint classification perspective. Your muscles that are more arranged in a pinnated formation, they are usually shorter, but they're able to produce more force because they have more muscle fibers. Any questions?
Is there advantage to type 1, type 2? Or not?
So, yeah, so that's not related to that particularly, this is just the arrangements, yeah. Yeah, so that's more the types of muscle fibers.
You said, well, whatever you lose, you gain in.
Yeah, so from a force reduction capability, and this is like a common theme, whatever you sacrifice in your ability to produce force, you typically gain in speed and range of motion. Thank you. Right, I'll harp on this over and over and over again, like, for those, especially going into PT, ortho, etc. I think it's important for you guys to have a general understanding of muscle origin and insertion points and their line of pull. Once you know that, you can typically address any orthopedic problem from like a muscle perspective. What else I want to say? The origin point is typically the point that is more proximal to the body. When I say proximal, what does that mean? Closer, and it's more stable, right? Typically, not always. Right? The origin is the most stable attachment, typically proximal. The insertion is typically distal. All right, also in this class, just to organize the information, I express the different muscles relative to their contraction characteristics related to the movement. So by that, I say there may be examples where I refer to a muscle as a prime mover or the main agonist mover. It doesn't mean that there aren't more muscles involved in the movement per se, all right? This is just from like an instruction perspective. Outside of the primary movers, you also have stabilizers, you have synergists, roles, as well as the antagonists, right? So hypothetically speaking, if I do a bicep curl and I do it in a supinated position, right? The primary mover will be identified as the biceps, right? But also there's other muscles responsible that play other roles, like the brachioradialis and the brachialis, right? They may not be the primary movers, but those are the assisters or the synergists, right? And then based off the identification of the primary mover, you can identify the muscle that plays the role of antagonist. Right, so if there's a bicep, the main antagonist there, at least from the bicep curl perspective, will be the triceps. Right, so again, I explain it in a way that's easy for you to digest, but also understand that it's a lot more complex than that. All right, other factors related to muscle strength, of course, is the size of the muscle and the length. Right, you guys told me you're good on levers, right? Okay, we'll see later on. Just know that in terms of our distal joints and our whole body in general, the most common form of a lever system that we see in our body is the third class lever. And it has the orientation that has our muscles acting at a mechanical disadvantage. Does that make sense? Right, so just to reiterate, the load here corresponds to the external load. The effort here can also be referred to our force producing capabilities. This is the insertion point of your muscles. And the fulcrum is just the axis of rotation about that joint, right? So when we consider knee extension, elbow extension, or knee extension, elbow flexion, the orientation is expressed as the third class lever. And it's important to consider that, especially for our muscles, we're referring to the insertion point of those muscles, all right? So from a knee extension perspective, we have the knee joint, that's the fulcrum, right? The attachment site or the line of pull from our quadriceps is realized at the tibial tuberosity. So it's past the line of the fulcrum. All right. And then if we're kicking out, typically the load is somewhere more distal to the insertion point. So from a biomechanical perspective, the lever arm from the external load to the axis is larger than the motor arm that is realized from the muscle to the axis of rotation. Does that make sense? Let's consider the bicep curl, right? From a supinated position, your biceps brachii actually attaches on the radial tuberosity. So it's past the point of the olecranon process, right? That olecranon process, others may refer to it as the epicondyle of the humerus. That is typically referred to as the axis point. So you notice that these insertion points, they cross relatively close to the axis, but they go past. And referring back to our discussion on levers, because this moment arm is so small, we have to produce a lot more force in our muscles relatively in order to move an external load, all right? But however, whatever we sacrifice in our force producing capabilities, we gain in speed and range of motion. All right? So because of this orientation, we're able to move our distal segments faster and cover more angular displacement or angular position. And I kind of reinforce that concept in those concepts in my biomechanics class. All right, a little bit about nerves. I really don't like this slide. You guys can actually cross this out. And the reason why is how the book explains this. I really wanted to cut that time. I really wasn't, messing with it, if I'm honest with you. For the nervous system, if we can divide it into our central nervous system and our peripheral nervous system. So our central nervous system is the brain and spinal cord. Our peripheral nervous system is everything else. Right? From a peripheral nervous system perspective, we have our autonomic and our somatic. So our autonomic is typically the functions of our viscera. And within the autonomic, we have our parasympathetic and our sympathetic. You can't really control those responses from a voluntary perspective, right? However, from the somatic perspective, these are where voluntary activation is realized, as well as sensory feedback and reflexes. So from the somatic perspective, this is where we have our sensory and our motor branches. All right, so this is where we'll be primarily emphasizing throughout the course of throughout the time in the course. And a plexus is just a branch network of nerves in our blood vessels. And you see that typically in the lower back and the arm, like the brachial plexus and lumbar plexus. All right, save this picture, especially those who are interested in grad school, because you'll see this time and time again. This just refers to the general dermatomes and myotomes. So the dermatomes is another word for the sensory innervation, and this is at the spinal cord level. And myotone refers to as the efferent pathways or the voluntary activation. And this is at the level of the spinal cord. And you notice here, from a sensory perspective, it expresses a little differently than from a voluntary activation perspective. All right, so just have this figure available, appreciate it now. I'm not going to test you extensively on it, but for those individuals who are going to grad school, you will be tested thoroughly about this. All right, we discussed this, and we pretty much discussed this, no issue there. All right, that will conclude the first class session. I appreciate your attention. Guys, we'll be back here next week. I'll also have Zoom going for those individuals who are opting to hop online. If you have any questions, comments, concerns, please don't hesitate to reach out to me, and I appreciate your time.
Hello.
What's going on?
I know, I'm not a new chair.
That's good, yeah.
I know, I'm feeling great. You're working with the brain more so.
Yeah.
What kind of work do you do again? Because I'm writing something for Fisher